Dr. Sujit, this is for you that I have had heavy periods since I started my first period. It lasts 5 days. There is very heavy bleeding for the initial 3 days. I have low iron levels. Sometimes I get exhausted. Can you suggest any form of exercise or diet to manage the heavy bleeding?
Okay, so this lady presents with a heavy bleeding, which is leading to anemia or low hemoglobin level, the reason for her fatigue, and that is how we'll now think of about management. So, firstly, heavy bleeding can be because of multiple reasons. We just don't jump into heavy bleeding and managing just with basic. There are basic medications which are available, which can lead to the bleeding becoming a little less, but we have to investigate. So let's begin with a sonography for her to rule out anything which is a pathology inside the uterus. It can be because of a fibroid, it can be because of an ovarian cyst. If, and then again coming back to a proper history, if the patient is in the adolescence age group or whether she's in the reproductive age group, currently that is how we plan to manage. Depending upon what we find out in the sonography, we accordingly guide the patient what needs to be the directed treatment. Most of the times, a basic, like I said, a basic pill, a basic treatment which reduces a bleeding, which can be taken during those periods, during the time of a menses, that itself can be sufficient. They are non-hormonal and they are very good, and it's not something which affects your daily life. You maybe take the immediately once you start bleeding from the day one itself, you can start with the treatment with that, and then you continue it maybe for 3 or 4 days and your bleeding reduces. Secondly, we can obviously think of a oral contraceptive pill. This itself can reduce the bleeding. There's a lot of drawback or a lot of negativity which is there currently in the society when it comes to pills. Pills themselves are very good. There are a lot of myths which are associated with pills. But then, as doctors, once we clarify that yes, depending upon your family history and depending upon your general history, if you fit for a pill, then it definitely works for you. Coming to the second thing, when we come to the fatigue part, it's definitely related to the heavy bleeding leading to low hemoglobin level. We check on a complete blood count, we check on the hemoglobin. We do a basic iron study to find out whether there's any iron deficiency related things, and maybe a HB electrophoresis, which gives us a basic idea if she has any hemoglobinopathies or any hemoglobin disorders. Once we figure this thing out, then we can accordingly pinpoint and manage it so that there is a directed treatment again. Fatigue, once you start taking iron tablets or iron formulations which are available in the market, they work pretty well. It takes at least a month for the hemoglobin to be corrected. So don't expect any magical correction within a few days. Within a month, you yourself will start feeling better. Particularly, there's no such exercise which increases your hemoglobin level, but then these directed things like a sonography, some blood test, some hormonal profile, if we are pinpointing it to some hormonal issue, itself can give you a generalized correction of your complaint.